6D-A4 is amended by striking the semicolon in the end and inserting parentheses and E during the period beginning on the date of the enactment of the American Rescue Plan Act of 2021 and ending on the last day of the first calendar quarter that begins 1 year after the last day of the emergency period described in the section 113G1B, a COVID-19 vaccine and administration of the vaccine in F during the period begin on the date and enactment of American Rescue Plan Act of 2021 and ending on the last day of the first calendar quarter that begins 1 year after the last day of the emergency period described in section 1135G1B, testing and treatments for COVID-19, including specialized equipment and therapies, including preventive therapies, and without regard to the requirements of section 1902A10B relating to severity in the case of any individual who is diagnosed with or presumed to have COVID-19 during the period such individuals are presumed to have COVID-19 and treatment of conditions that may seriously complicate the treatment of COVID-19 if otherwise covered under the state plan or waiver of such plans. 2, making COVID-19 vaccines available in additional eligibility groups and treatment available to certain uninsured. Section 1902A10 of such Acts 42 U.S.C. 1396 AA10 is amended to matter the following subparagraph. G, A, by striking and other conditions which may complicate pregnancy. 8, and insert medical assistance for services related to other conditions which may complicate pregnancy and medical assistance for vaccines described on section 1905A4E and administration of such vaccines during the period described in such sections. 8, B, by inserting in medical assistance for vaccines described in section 1905A4E and the administration of such vaccines during the period described in such after described in the subsection Z2. C, by inserting and medical assistance for vaccines described in section 1905A4E and the administration of such vaccines during the period described in such sections after described in subsection K1. D, by inserting and medical assistance for vaccine described in section 1905A4E and the administration of such vaccines during the period described in such sections after family planning section. E, by striking and by any visit described in section 1916A2G that is furnished during any such portion and inserting any service described in section 1916A2G that they're furnished during any such portion, any vaccine described in section 1905A4E and the administration of such vaccine that is furnished during any such portion in testing and treating with COVID-19, including specialized equipment and therapies, including preventative therapies, and in case of individuals who is diagnosed with a presumed having COVID-19 during the period such individuals are presumed to have COVID-19, the treatment of a condition that may seriously complicate the treatment of COVID-19 and otherwise conveyed under the state plan or waiver of such plan, and if by striking the semicolon at the end and inserting 19 medical assistance shall be made available during the period described in section 1905A4E for vaccines described in such section and administration of such vaccines for any individual who is eligible and receiving medical assistance under the state plan or under a waiver of such plan other than an individual who is eligible for medical assistance consisting only of payment of premiums pursuant to subparagraph E or F or section 1933, notwithstanding any provisions of this title or waiver under section 1115 impacting such individuals' eligibility for medical assistance under such plans or waivers to cover for a limited type of benefits and services that would not otherwise include coverage of COVID-19 vaccines and administrations. 3, prohibition of cost sharing. A, in general, subsection A2 and B2 of section 1916 of the Security Act of 42 U.S.C. 1396 OR each amended. 1, in subparagraph F4, striking or and at the end. 2, in subparagraph G by striking and by 3 by adding the ending to the following subparagraph H during the period beginning on the date of the enactment of this subparagraph and ending on the last day of the first calendar quarter that begins 1 year after the last date of the emergency period described in the section 1135G1B, a COVID-19 vaccine and the administration of such vaccines for any individual eligible for medical assistance for such vaccines and administration or I during the period beginning on a date of enactment of the said paragraph and ending on the last day of the first calendar quarter that begins 1 year after the last day of the emergency period described in section 1135G1B. Testing and treatments for COVID-19 include specialized equipment and therapies, including preventative therapies, and in the case of individuals who are diagnosed with the presumed to have COVID during the period during which individuals have or presumed to have COVID, the treatment of a condition that may seriously complicate the treatment of COVID-19 is otherwise covered under the state plan or waiver of such plan, and B, applications to alternate cost sharing. Section 1916A-B-3B of the Social Security Act 42 U.S.C. 1396-01B-3B is amended. 1, in Clause 11 by striking any visit and inserting any services, and 2, by adding any end of the following clauses. 12, during the period beginning on the date of the enactment of this clause and ending on the last day of the first calendar quarter that begins 1 year after the last day of the emergency period and described in Section 1135G1B, a COVID-19 vaccine and the administration of such vaccines for individuals eligible for the medical assistance for such vaccines and administrations. 13, during the period beginning on the date of the enactment of this clause and ending on the last day of the first day of the last calendar quarter that begins 1 year after the last date of the emergency period described in Section 1135G1B, testing and treatment for COVID-19, including the specialized equipment and therapies, including preventative therapies, in the case of individuals who are diagnosed with or presumed to have COVID-19 during the period during which such individuals have or presumed to have COVID-19, the treatment of conditions that may severely complicate the treatment of COVID-19 if otherwise covered under the state plan or waiver of such plan. 4, inclusion of the Medicaid drug rebate program or covered outpatient drugs used for COVID-19 treatment. A, in general, the requirements of Section 1927 of the Social Security Act 42 U.S.C. 1396 RB shall apply to any drug or biological product to which subparagraph 8 of the Section 1905A4 of such act are aided by paragraph 1 applies to, or which the subclause 18 in the matter following subparagraph 3 of Section 1902A10 of such act and added by paragraph 2 applies this. 1, furnished as medical assistance in accordance with Section 1902A10A of such act and such paragraph F or subclause 18 and Section 1902A10A of such act are applicable for the treatment or prevention of COVID-19 as described in such paragraph or subclause respectively, and 2, as covered outpatient drugs as defined in the Section 1927K of such act, except that in applying paragraph 2A of such section and drugs to which such subparagraph F or such subclause 18 applies, such drugs shall be deemed a prescribed drug for purposes of such 1905A12 of such act. B, conforming amendment, Section 1927D7 of the Security Act of 42 U.S.C. 1396 R8D7 is amended by adding at the end of the following new subparagraph. E, drugs and biological products to which 1905A45 and subclause 18 is a matter of following subparagraph G of Section 1902A10, applying that all furnished as medical assistance is accordance to such section or clause respectively for the treatment or prevention of COVID-19 as described in the subparagraph or subclause respectively in Section 1902A10A. 5, alternative benefit plan, Section 1937B of the Social Security Act 42 U.S.C. 1396-78 is amended by adding at the end of the following paragraph 8, COVID-19 vaccines testing and treatment, notwithstanding the previous provisions of this section, a state may not provide for medical assistance through enrollment of an individual with benchmark coverage or benchmark equivalent coverage under this section unless during the period beginning on the date of the enactment of American Rescue Plan Act of 2021 and ending on the last day of the first calendar quarter that begins on 1 year after the last day of the emergency period described in Section 1135G1B. Such coverage includes and does not impose any deduction, cost sharing, or similar changes. A, COVID-19 vaccines and administration of vaccines, and B, testing the treatments for COVID-19, including specialized equipment and therapies, including preventative therapies in the case of such an individual who diagnosed with or presumed to have COVID-19 during the period such individuals have or presumed to have had COVID-19, the treatment of conditions that may seriously complicate the treatment and the state ban or waiver of such applications.
B, temporary increase in federal payments for coverage and administration of COVID-19 vaccines, Section 1905 of the Social Security Act, 42 U.S.C. 1396D is amended. 1, in subsection B by striking and FF and inserting FF and HH. 2, in subsection FF in the matter preceding paragraph 1 by inserting subject matter to subsection HH after or Z2, and 3, by adding at the end of the following new subsection, HH temporary increase FPM AP for medical assistance for coverage and administration of COVID-19 vaccines 1, in general, notwithstanding any other provision of this title during the period described in paragraph 2, the federal medical assistance percentage for a state with respect to amounts expended by the state for medical assistance for a vaccine described in subsection A for E and the administration of such vaccine shall be equal to 100%. 2, period described. That period described in this paragraph is the period that A, begins on the first day of the month of the first quarter, beginning after the date of the enactment of this subsection, and B, ends on the last day of the first quarter that begins 1 year after the last day of the emergency period described in section 1135 G1B. 3, exclusion of expenditures from territorial caps. Any payment made to a territory for expenditures for medical assistance under subsection A4E3 that are subject to the federal medical assistance percentage specified under paragraph 1 shall not be taken into account for purposes of applying payment limits under subsections F and G of sections 1108, Section 1812, modifications to certain coverage under Medicaid for pregnant and postpartum women. A, state option. Section 1902E of the Social Security Act, 42 U.S.C. 1396 AE is amended by adding at the end of the following new paragraph, 16, extending certain coverage for pregnant and postpartum women. A, in general, at the option of the state plan or waiver of such state plan may provide that an individual who, while pregnant, is eligible for and has received medical assistance under the state plan approved under this title or a waiver of such plan, including during a period of retroactive eligibility under Section A34, shall, in addition to remaining eligible under paragraph 5 for all pregnancy-related and postpartum medical assistance available under the state plan or waiver through the last day of the month in which the 60-day period beginning on the last day of her pregnancy ends, remains eligible under the state plan or waiver for medical assistance for the period beginning on the first day occurring after the end of such 60-day period and ending on the last day of the month in which the 12-month period beginning on the last day of her pregnancy ends. B, full benefits during pregnancy and throughout the 12-month postpartum period. The medical assistance provided for a pregnant or postpartum individual by a state making an election under this paragraph without regard to this basis on which the individual is eligible for medical assistance under the state plan or waiver shall, 1, include all terms and services covered under the state plan or waiver that are not less in amount, duration, or scope or are determined by the Secretary to be substantially equivalent to the medical assistance available for an individual described in subsection A10A1, and 2, be provided for the individual while pregnant and during the 12-month period that begins on the last day of the individual's pregnancy and ends on the last day of the month in which such 12-month period ends. C, coverage under CHIP. A state making an election under this paragraph that covers under Title 21, Child Assistance Program for targeting low-income children who are pregnant or targeted low-income pregnant women are applicable shall also make the election under Section 2107E1J of such title. B, effective date, the amendment made by subsection A shall apply with respect to state elections made under paragraph 16 of Section 1902E of the Social Security Act, 42 U.S.C. 1396 AE, as added by subsection A, during the 5-year period beginning on the first day of the first fiscal year quarter that begins 1 year after the date of the enactment of this act. Section 9813, state option to provide qualifying community-based mobile crisis intervention services. Title 19 of the Social Security Act is amended by adding Section 1946, 42 U.S.C. 1396 W5, the following new section. Section 1947, state option to provide qualifying community-based mobile crisis intervention services. A, in general, notwithstanding Section 1902A1 relating to statewide, Section 1902A10B relating to comparability, Section 1902A23A relating to freedom of choice of providers, or Section 1902A27 relating to providing agreements, a state may, during the 5-year period beginning on the first day of the first fiscal year quarter that begins on or after the date that is 1 year after the date of the enactment of this section, provide medical assistance for qualifying community-based mobile crisis intervention services. B, qualifying community-based mobile crisis intervention services defined. For purposes of this section, the term qualified community-based mobile crisis intervention services means, with respect to a state, items and services for which medical assistance is available under the Senate plan under this title or a waiver of such plan that are 1, furnished to an individual otherwise eligible for medical assistance under the state plan or waiver of such plan who is A, outside of a hospital or other facility setting, and B, experiencing a mental health or substance use disorder crisis. 2, furnished by multidisciplinary mobile crisis teams, A, that includes at least one behavioral health care professional who is capable of conducting an assessment of the individual in accordance with the professional's permitted scope of practice under state law, and other professionals or paraprofessionals with appropriate expertise in behavioral health or mental health crisis response, including nurses, social workers, peer support, specialists, and others, as designated by the state through a state plan amendment or waiver of such plan. B, whose members are trained in trauma, information care, de-escalation strategies, and harm reduction. C, that is able to respond in a timely manner and where appropriate provide 1, screening and assessment, 2, stability and de-escalation, and 3, coordination with and referrals to health, social, and other services and supports as needed and healthcare services as needed. B, that maintains relationships with relevant community partners, including medical and behavioral health care providers, primary care providers, community health centers, crisis respite centers, and managed care organizations if applicable. And E, that maintains the privacy and confidentiality of patient information consistent with federal and state requirements, and 3, available 24 hours per day, every day of the year. E, payments, notwithstanding Section 1905B or 1905FF, and subject to subsections Y and Z of Section 1905, during each of the first 12 fiscal quarters occurring during the period described in subsection A, that a state meets the requirements described in subsection D. The federal medical assistance percentage applicable to amounts expended by the state for medical assistance for qualifying community-based mobile crisis intervention services furnished during each quarter shall be equal to 85%. In no case shall the application of the previous sentence result in the federal medical assistance percentage applicable to amounts expended by state for medical assistance for such qualifying community-based mobile crisis intervention center services furnished during a quarter being less than the federal medical assistance percentage that would apply to such amounts expended by the state for such services furnished during such quarter without application of the previous sentence. D, requirements. The requirements described in this subsection are the following. 1, the state demonstrates to the satisfaction of the Secretary that it will be able to support the provision of qualifying community-based mobile crisis intervention services that meet the conditions specified in subsection B. 2, the state provides assurances satisfactory to the Secretary that A, any additional federal funds received by the state for qualifying community-based mobile crisis intervention services provided under the section that are attributable to the increased federal medical assistance percentage under subsection E will be used to supplement and not supplant the level of state funds expended for such services for the fiscal year preceding the first fiscal quarter occurring during the period described in subsection A. B, if the state made qualifying community-based mobile crisis intervention services available in a region of the state in such fiscal year, the state will continue to make services available in each such region under this section during each month occurring during the period described in subsection A, for which the federal medical assistance percentage under subsection C is applicable with the rest of the state. E, funding for state planning grants. There is appreciated out of any funds in the Treasury not otherwise appropriated $15 million to the Secretary for purposes of implementing, administering, and making planning grants to states as soon as practicable for purposes of developing a state plan amended or sectioned 1115, 1915B, or 1915C. Waiver requests or amendment to such waiver to provide qualifying community-based mobile crisis intervention services under this section to remain available until expended. Section 9814, temporary increase in FPM AP for medical assistance under state Medicaid plans for which begin to expend amounts for certain mandatory individuals. Section 1905 of the Social Security Act, 42 U.S.C. 1396D, as amended by Section 9811 of this subtitle, is further amended. 1, in subsection B, in the first sentence by striking add HH and inserting HH and 2, and 2 in section FF by striking subject to subsection HH and inserting subject to sections HH and 2, and 3 by adding at the end of the following new section 2, temporary increases in FPAMP for medical assistance under state Medicaid plans which begin to expend amounts for certain mandatory individuals. 1, in general, for each quarter occurring during the 8-quarter period beginning with the first calendar quarter during which a qualified state, as defined in paragraph 3, expends amounts for all individuals described in section 1902A10A1 8 under the section plan or waiver of such plan, the federal medical assistance percentage determined under subsection B for such states shall, after application of any increase, if applicable, under section 6008 of the Family's First Coronavirus Response Plan, be increased by 5 percentage points, except for any quarter in each subsequent quarter during such period during which the state ceases to provide medical assistance to any such individual under the state plan or waiver of such plan. 2, Special application rules. Any increase described in paragraph 1 or payment made for expenditures on medical assistance that are subject to such increase, A, shall not apply with respect to disproportionate share hospital payments described in section 1923. B, shall not be taken into account in calculating the enhanced FMAP of a state under section 2105. C, shall not be taken into account for purposes of Part A, D, E of Title IV, and D, shall not be taken into account for purposes of applying payments limits under subsections F and G of Section 1108. Definition. For purposes of this subsection, the term qualifying state means a state which has not expended amounts for all individuals described in Section 1902A10A18 before the date of the enactment of this subsection. Section 9815, extension of 100% federal medical assistance percentage to urban Indian health organizations and Native Hawaiian healthcare systems. Section 1905B of the Social Security Act, 42 U.S.C. 1396 DB, is amended by inserting after, as defined in Section 4 of the Indian Healthcare Improvement Act, the following. For the 8 fiscal year quarters, beginning with the fiscal year quarter beginning after the date of the enactment of the American Rescue Plan of 2021, the federal medical assistance percentage shall also be 100% per centum with respect to amounts expended as medical assistance for services which are received through an urban Indian organization as defined in paragraph 29 of Section 4 of the Indian Healthcare Improvement Act that is granted or contracted with the Indian Healthcare Service under Title V of such act, and for such 8 fiscal year quarters, the federal medical assistance percentage shall also be 100% with respect to amounts expended as medical assistance for services which are received through a Native Hawaiian healthcare center as defined in Section 12.4 of the Native Hawaiian Healthcare Improvement Act, or a qualifying entity as defined in Section 6B of such act that has a grant or contract with the Papa Olau Lokahai under Section 8 of such act. Section 9816, sunset of limit on maximum rebate amount for single-source drugs and innovator multiple-source drugs. Section 1927 C2D of the Social Security Act, 42 U.S.C. 1396 R8 C2D, is amended by inserting after December 13, 2009, the following, and before January 1st, 2024. Section 9817, additional support for Medicaid home and community-based services during the COVID-19 emergency. A, increase in FMAP. 1, in general, notwithstanding Section 1905B of the Social Security Act, 42 U.S.C. 1396 DB, or Section 1905 FF in the case of a state that meets the HCBS program requirements under subsection B, the federal medical assistance percentage determined for the state under Section 1905B of such act, or if applicable under Section 1905 FF, and if applicable increased under subsection Y, Z, AA, or 2 of Section 1905 of such act, 42 U.S.C. 1396D, Section 1915K of such act, 42 U.S.C. 1396 NK, or Section 6008A of the Families First Coronavirus Response Act, Public Law 116127. I shall be increased by 7.35 percentage points with respect to expenditures of the state under the state Medicaid program for home and community-based services as defined in paragraph 2B that are provided during the HCBS program improvement period as defined in paragraph 2A. In no case may the application of the previous sentence result in the federal medical assistance percentage determined for a state being more than 95% with respect to such expenditures. Any payment made to Puerto Rico, the Virgin Islands, Guam, the Northern Mariana Islands, or American Samoa for expenditures on a medical assistance that are subject to the federal medical assistance percentage increase specified under the first sentence of this paragraph should not be taken into account for purposes of applying payment limits under subsections F and G of Section 1108 of the Social Security Act, 42 U.S.C. 1308. 2, definitions in this section. A, HCBS program improvement period. The term HCBS program improvement period means with respect to a state the period 1, beginning on April 1st, 2021, and 2, ending on March 31st, 2022. B, home and community-based services. The term home and community-based services mean any of the following. 1, home health care services authorized under paragraph 7 of Section 1905A of the Social Security Act, 42 U.S.C. 1396 DA. 2, personal care services authorized under paragraph 24 of such section. 3, pay services authorized under paragraph 26 of such section. 4, home and community-based services under subsections B, C, I, J, and K of section 1915 of such act, 42 U.S.C. 1396 and N. Such services authorized under a waiver under section 1115 of such act, 42 U.S.C. 1315, and such services through coverage authorized under section 1937 of such act, 42 U.S.C. 1396 U7. 5, case management services authorized under section 1905A19 of the Social Security Act, 42 U.S.C. 1396 D.A. 19, and Section 1915G of such act, 42 U.S.C. 1396 N.G. 6. Rehabilitative services, including those related to behavioral health, described in Section 1905 A13 of such act, 42 U.S.C. 1396 D.A. 13. 7. Such other services specified by the Secretary of Health and Human Services. C. Eligible individual. The term eligible individual means an individual who is eligible for and enrolled for medical assistance under a state Medicaid program, and includes an individual who becomes eligible for medical assistance under a state Medicaid program when removed from a waiting list. D. Medicaid program. The term Medicaid program means, with respect to a state, the state program under Title 19 of the Social Security Act, 42 U.S.C. 1396 et sec, including any waiver or demonstration under such title under Section 1115 of such act, 42 U.S.C. 1315 related to such title. E. State. The term state has the meaning given such term for purposes of the Title 19 of the Social Security Act, 42 U.S.C. 1396 et sec. B. State requirements for FMAP increase. As conditions for receipt of the increase under subsection A to the federal medical assistance percentage determined for a state, the state shall meet each of the following requirements referred to in subsection A as HCBS program requirements. 1. Supplement, not supplant. The state shall use the federal funds attributed to the increase under subsection A to supplement and not supplant the level of state funds expended for home and community-based services for eligible individuals through programs in effect as of April 1st, 2021. Required implementation of certain activities, the state shall implement or supplement the implementation of one or more activities to enhance, expand, or strengthen home and community-based services under the state Medicaid program. Section 9818, funding for state strike teams for residential and employee safety in nursing facilities. Section 1919 of the Social Security Act, 42 U.S.C. 1396R, is amended by adding to the end the following new subsection. K, funding for state strike teams. In addition to amounts otherwise available, there is appropriated to the Secretary out of any monies in the Treasury not otherwise appropriated $250 million to remain available until expended for purposes of allocating such amount among the states, including the District of Columbia and each territory of the United States. For such a state to establish and implement a strike team that will be deployed to a nursing facility in the state with diagnosed or suspected cases of COVID-19 among residents or staff for the purposes of assistance with clinical care, infection control, or staffing during the emergency period described in Section 1135 G1B and the 1-year period immediately following the end of such emergency period. Section 9819, special rule for the period of a declared public health emergency related to coronavirus. A, in general, Section 1923 F3 of the Social Security Act, 42 U.S.C. 1396R 4F3 is amended. 1, in the subparagraph A by striking subparagraph E and inserting subparagraphs E and F, and 2, by adding to the end the following new subparagraph F, allotments during the coronavirus temporary Medicaid FMAP increase. In A, 1, in general, notwithstanding any other provision of this subsection for any fiscal year for which the federal medical assistance percentage applicable to expenditures under this section is increased pursuant to Section 6008 of the Families First Coronavirus Response Act, the Secretary shall recalculate the annual DSH allotment, including the DSH allotment specified under paragraph 6A6, to ensure that the total DSH payment, including both federal and state shares that a state may make related to a fiscal year, is equal to the total DSH payments that the state could have made for such fiscal year without such increase to the federal medical assistance percentage. 2, no application to allotments beginning after COVID-19 emergency period. Did the DSH allotment for any state for the first fiscal year beginning after the end of the emergency period described in Section 1135 G1B or any succeeding fiscal year shall be determined under this paragraph without regard to the DSH allotment determined under Clause 1. B, effective date. The amendment made by subsection A shall take effect and apply as if included in the enactment of the Families First Coronavirus Response Act, Public Law 116-127. Subtitle K, Children's Health Insurance Program. Section 9821, mandatory coverage of COVID-19 vaccines and administration and treatment under CHIP. A, coverage. 1, in general, Section 2103C of the Social Security Act, 42 U.S.C. 1397 CCC is amended by adding to the end the following paragraph. 11, required coverage of COVID-19 vaccines and treatment regardless of the type of coverage elected by a state under subsection A, the child health assistance provided for a targeted low-income child, and in the case of a state that elects to provide pregnancy-related assistance pursuant to Section 2112, the pregnancy-related assistance provided for a targeted low-income pregnant woman, as such terms are defined for purposes of such section, shall include coverage during the period beginning on the date of the enactment of this paragraph and ending on the last day of the first calendar quarter that begins 1 year after the last day of the emergency period described in Section 1135 G1B of A COVID-19 vaccine and the administration of the vaccine, and B, testing and treatment for COVID-19, including specialized equipment and therapies, including preventative therapies, and in the case of an individual who is diagnosed or presumed to have COVID-19 during the period during which such individual has or is presumed to have COVID-19, the treatment of a condition that may be seriously complicate the treatment of COVID-19 if otherwise covered under the state health care plan or waiver of such plan. 2, prohibition of cost sharing, Section 2103E2 of the Social Security Act, 42 U.S.C. 1397 CCE2, as determined by Section 6004B3 of the Families First Coronavirus Response Act, is amended, A, in the paragraph header by inserting a COVID-19 vaccine, COVID-19 treatment for or related pregnancy-related assistance, and B, by striking visits determined in Section 1916 A to G or, and inserting services described in Section 1916 A to G, vaccines described in Section 1916 A to H, administered during the period described in such section, and the administration of such vaccines, testing or treatment described in Section 1916 A to 1, furnished during the period described in such section, or B, temporary increase in federal payments for coverage and administration of COVID-19 vaccines, Section 2105C of the Social Security Act, 42 U.S.C. 1397 EEC, is amended by adding at the end of the following new paragraph. 12, temporary enhanced payment for coverage and administration of COVID-19 vaccines during the period described in Section 1905 HH2, notwithstanding subsection B, the enhanced FMAP for a state with respect to payments under subsection A for expenditures under the state child health care plan or a waiver of such plan for a vaccine described in Section 1905A4E, and the administration of such vaccine shall be equal to 100%. Adjustment of CHIP allotments, Section 2104M of the Social Security Act, 42 U.S.C. 1397 DDM is amended. 1, in paragraph 2B in the matter proceeding clause 1, by striking paragraphs 5 and 7 and inserting paragraphs 5, 7, and 12, and 2, by adding at the end of the following new paragraph 12, adjusting allotments to account for increased federal payments for coverage and administration of COVID-19 vaccines if a state, commonwealth, or territory receives payments for a fiscal year beginning with fiscal year 2021 under subsection A of Section 2105 for expenditures that are subject to the enhanced FMAP specified under subsection C12 of such section. The amount of the allotment determined for the state, commonwealth, or territory under this section A for such fiscal year shall be increased by the projected expenditures for such year by the state, commonwealth, or territory under the state child health care plan or a waiver of such plan for vaccines described in Section 1905A4E and the administration of such vaccines. And B, once actual expenditures are available in the subsequent fiscal year, the fiscal year allotment that was adjusted by the amount described in subparagraph A shall be adjusted on the basis of the difference between 1, such projected amounts of expenditures described in subparagraph A for such fiscal year described in such subparagraph by the state, commonwealth, or territory, and 2, the actual amount of expenditures for such fiscal year described in subparagraph A by the state, commonwealth, or territory under the state child health care plan or waiver of such plan for vaccines described in Section 1905A4E and the administration of such vaccines.
Section 9822, modifications to certain coverage under CHIP for pregnant and postpartum women. A, modifications to coverage. 1, in general, Section 2107E1 of the Social Security Act, 42 U.S.C. 1397 GGE1, is amended. A, by redesignating subparagraphs J through S as subparagraphs K through T, respectively, and B, inserting after paragraph 1 the following new subparagraph. J, paragraphs 5 and 16 of Section 1902E, relating to the state option to provide medical assistance consisting of full benefits during pregnancy and throughout the 12-month postpartum period under Title 19. If the state provides child health assistance for targeted low-income children who are pregnant or to targeted low-income pregnant women, and the state has elected to apply such paragraph 16 with respect to pregnant women under Title 19, the provision of assistance under the Child Health Care Plan or waiver for targeted low-income children or targeted low-income pregnant women during pregnancy and the 12-month postpartum period shall be required and not at the option of the state and shall include coverage of all items or services provided to the targeted low-income child or targeted low-income pregnant woman as applicable under the state child health plan or waiver. 2, additional coverage of targeted low-income pregnant women, Section 2112D2A of the Social Security Act, 42 U.S.C. 1397 LLD2A, is amended by inserting after 60-day period the following, or in the case that subparagraph A of Section 1902E16 applies to the child health plan or waiver of such plan pursuant to Section 2107E1, the 12-month period. B, effective date. The amendments made by subsection A shall apply with respect to state elections made after paragraph 16 of Section 1902E of the Social Security Act, 42 U.S.C. 1936 AE, as added by Section 9812 of Subtitle J of this title during the 5-year period beginning on the first day of the first fiscal year quarter that begins 1 year after the date of the enactment of this Act. Subtitle L, Medicare. Section 9831, floor in the Medicare area wage index for hospitals in all urban states. A, in general, Section 1886D3E of the Social Security Act, 42 U.S.C. 1395 WDE3E is amended. 1, in Clause 1 in the first sentence by striking or 3 and inserting 3 or 4, and 2 by adding at the end of the following new clause 4, floor on area wage index for hospitals in all urban states. 1, in general, for discharges occurring on or after October 1st, 2021, the area wage index applicable under the subparagraph to any hospital in an all-urban state as defined in subclause 4 may not be less than the minimum area wage index for the fiscal year for hospitals in that state as established under subclause 2. 2, minimum area wage index. For the purposes of subclause 1, the Secretary shall establish a minimum area wage index for a fiscal year for hospitals in each all-urban state using methodology described in Section 412.64H46 of Title 42, Code of Federal Regulations, as in effect for fiscal year 2018. 3, waiving budget neutrality. Pursuant to the 5th sentence of the Clause 1, this clause shall not be applied in a budget-neutral manner. 4, all urban state defined. In this clause, the term all urban state means a state in which there are no rural areas as defined in paragraph 2D, or a state in which there are no hospitals classified as rural under the section. B, waiving budget neutrality, Section 1886D3E1 of the Social Security Act, 42 U.S.C. 1395 WD3E1 is amended in the 5th sentence, 1, by striking and the amendments and inserting the amendments, and 2, by inserting and the amendments made by Section 9831A of the American Rescue Plan Act of 2021 after CARE Act. Section 9832, secretarial authority to temporarily waive or modify application of certain Medicare requirements with respect to ambulance services furnished during certain emergency periods. A, waiver authority, Section 1135B of the Social Security Act, 42 U.S.C. 1320B-5B, is amended, 1, in the first sentence, A, in paragraph 7 by striking and at the end, B, in paragraph 8 by striking the period at the end and inserting and C, by inserting after paragraph 8 the following new paragraph. 9, any requirement after Section 1861S7 or Section 1834I that an ambulance service includes the transport of an individual to the extent necessary to allow payment for ground ambulance services furnished in response to a 911 call or the equivalent in areas without a 911 call system in cases in which an individual would have been transported to a destination permitted under Medicare regulations as described in Section 410.40 to Title 42, Code of Federal Regulations, or successor regulations, but such transport did not occur as a result of community-wide emergency medical service EMS protocols due to the public health emergency described in subsection G1B, and 2, in the flesh matter at the end by adding at the end of the following. Ground ambulance services for which payment is made pursuant to paragraph 9 shall be paid at the base rate that would have been paid under the fee schedule established under 1834I excluding any mileage payments if the individual had been so transported and without respect to ambulance services furnished by a critical access hospital or an entity described in paragraph 8 of such section at the amount and otherwise would be paid under such paragraph. B, emergency period exception. Section 1135G1B of the Social Security Act, 42 U.S.C. 1320B, G5G 1B is amended in the matter preceding clause 1 by striking subsection B8 and inserting paragraphs 8 and 9 of subsection B. Section 9833, funding for office for Inspector General. In addition to amounts otherwise available, there is appropriated to the Inspector General of the Department of Health and Human Services for fiscal year 2021, out of any money in the Treasury not otherwise appropriated, $5 million to remain available until expended for oversight of activities supported with funds appropriated to the Department of Health and Human Services to prevent, prepare for, and respond to coronavirus 2019 or COVID-19 domestically or internationally. Subtitle M, Coronavirus State and Local Fiscal Recovery Funds. Section 9901, Coronavirus State and Local Fiscal Recovery Funds. A, in general, Title 6 of the Social Security Act, 42 U.S.C. 801 et sec, is amended by adding at the end the following. Section 602, Coronavirus State Fiscal Recovery Fund. A, appropriation. In addition to amounts otherwise available, there is appropriated for fiscal year 2021 out of any money in the Treasury not otherwise appropriated. 1, $219.8 billion to remain available through December 31st, 2024 for making payments under this section to states, territories, and tribal governments to mitigate the fiscal effects stemming from the public health emergency with respect to coronavirus COVID-19, and 2, $50 million to remain available until expended for the cost of the Secretary for administration of the funds established under this title. B, authority to make payments. 1, payments to territories. A, in general, the Secretary shall reserve $4.5 billion of the amount appropriated under subsection A1 to make payments to the territories. B, allocation of the amount reserved under subparagraph A. 1, 50% of such amount shall be allocated by the Secretary equally to each territory, and 2, 50% of such amount shall be allocated by the Secretary as an additional amount to each territory in an amount which bears the same proportion to half of the local amount reserved under subparagraph A as the population of the territory bears to the total population of all such territories. C, payment. The Secretary shall pay each territory the total amounts allocated for the territory under subparagraph B in accordance with paragraph 6. 2, payments to tribal governments. A, in general, the Secretary shall reserve $20 billion of the amount appropriated under subsection A1 to make payments to tribal governments. B, allocation of the amount reserved under subparagraph A. 1, $1 billion shall be allocated by the Secretary equally among each of the tribal governments, and $19 billion, and 2, $19 billion shall be allocated by the Secretary to the tribal governments in a matter determined by the Secretary. C, payment. The Secretary shall pay each tribal government the total of the amounts allocated for the tribal government under subparagraph B in accordance with paragraph 6. 3, payments to each of the 50 states in the District of Columbia. A, in general, the Secretary shall reserve $195.3 billion of the amount appropriated under subsection A1 to make payments to each of the 50 states in the District of Columbia. B, allocations of the amount reserved under subparagraph A. 1, $25.5 billion of such amounts shall be allocated by the Secretary equally among each of the 50 states in the District of Columbia. 2, an amount equal to $1.25 billion less than the amount allocated for the District of Columbia pursuant to Section 601C6 shall be allocated by the Secretary as an additional amount to the District of Columbia. And 3, an amount equal to the remainder of the amount reserved under subparagraph A after the application of clauses 1 and 2 of the subparagraph shall be allocated by the Secretary as an additional amount to each of the 50 states in the District of Columbia in an amount which bears the same proportion to such remainder as the average estimated number of seasonally adjusted unemployed individuals as measured by the Bureau of Labor Statistics Local Urban Unemployment Statistics Program and in the state or District of Columbia over the 3-month period ending with December 2020 bears to the average estimated number of seasonally adjusted unemployed individuals in all of the 50 states and the District of Columbia over the same period. C, payment. 1, in general, subject to clause 2, the Secretary shall pay each of the 50 states in the District of Columbia from the amount reserved under subparagraph A, the total of the amounts allocated for the state and District of Columbia under subparagraph B in accordance with paragraph 6. 2, minimum payment requirement. 1, in general, the sum of A, the total amounts allocated for one of the 50 states or the District of Columbia under subparagraph B as determined without regard to this clause, and B, the amounts allocated under Section 603 to the state for distribution by the state to the non-entitlement units of local government in the state and to metropolitan cities and countries in the state shall not be less than the amount paid to the state of or District of Columbia for fiscal year 2020 under Section 601. 2, pro rata adjustments. The Secretary shall adjust on a pro rata basis the amount of the allocations for each of the 50 states in the District of Columbia determined under subparagraph B3 without regard to this clause to the extent necessary to comply with the requirements of subclause 1. 4, pro rata adjustment authority. The amounts otherwise determined for allocation and payment under paragraphs 1, 2, and 3 may be adjusted by the Secretary on a pro rata basis to the extent necessary to ensure that all available funds are allocated to states, territories, and tribal governments in accordance with the requirements specified in each paragraph as applicable. 5, population data. For purposes of determining allocations for a territory under this section, the population of the territory shall be determined based on the most recent data available from the Bureau of the Census. 6, timing. A, in general, to the extent practicable with respect to each state and territory allotted a payment under the subsection, the Secretary shall make the payment required for the state or territory not later than 60 days after the date on which the certification required under subsection D1 is provided to the Secretary. B, tribal governments. To the extent practicable with respect to each tribal government for an amount is allocated under the subsection, the Secretary shall make the payment required for the tribal government not later than 60 days after the date of enactment of this section. C, initial payment to District of Columbia. The Secretary shall pay the amount allocated under paragraph 3B2 to the District of Columbia not later than 15 days after the date of enactment of this section. C, requirements. 1, use of funds. Subject to paragraph 2 and except as provided in paragraph 3, a state, territory, or tribal government shall only use the funds provided under a payment made under this section or transferred pursuant to section 603C4 to cover costs incurred by the state, territory, or tribal governments by December 31st, 2024. A, to respond to the public health emergency with respect to the coronavirus disease 2019, COVID-19, or its negative economic impacts, including assistance to households, small businesses, and nonprofits, or aid to impacted industries such as tourism, travel, and hospitality. B, for the provision of government services to the extent of the reduction in revenue of such state, territory, or tribal government due to such emergency, or C, to make necessary investments in water, sewer, or broadband infrastructure. 2, further restriction on use of funds. A, in general, a state or territory shall not use the funds provided under the section or transferred pursuant to section 603C4 to either directly or indirectly offset a reduction in the net tax revenue of such state or territory resulting from a change in law, regulation, or administrative interpretation during the covered period that reduces any tax by providing a reduction in a rate, a rebate, a deduction, a credit, or otherwise, or delays the imposition of any tax or tax increase. B, pension funds. No state or territory may use funds made available under this section for deposit into any pension fund. 3, transfer authority. A state, territory, or tribal government receiving a payment from funds made available under this section may transfer funds to a private nonprofit organization, as that term is defined in paragraph 17 of section 401 of the McKinney-Vento Homeless Assistance Act, 42 U.S.C. 11360-17. A tribal organization, as that term is defined in section 4 of the Indian Self-Determination and Education Assistance Act, 25 U.S.C. 5304. A public benefit corporation involved in the transportation of passengers or cargo, or a special purpose unit of state or local government. D, certifications and reports. 1, in general, in order for a state or local territory to receive a payment under this section or a transfer of funds under section 603C4, the state or territory shall provide the Secretary with a certification signed by an authorized officer of such state or territory that such state or territory requires the payment or transfer to carry out the activities specified in subsection C of this section and will use any payment under this section or transfer of funds under section 603C4 in compliance with subsection C of this section. 2, reporting. Any state, territory, or tribal government receiving a payment under this section shall provide to the Secretary periodic reports providing a detailed accounting of A, the uses of funds by such state, territory, or tribal government, including, in the case of a state or territory, all modifications to the state's or territory's tax revenue sources during the cover period, and B, such other information as the Secretary may require for the administration of this section. E, recoupment. Any state, territory, or tribal government that has failed to comply with subsection C shall be required to repay to the Secretary an amount equal to the amount of funds used in violation of such subsection, provided that, in the case of a violation of subsection C2A, the amount of state or territory shall be required to repay shall be lesser of 1, the amount of the applicable reduction in net tax revenue attributable to such violation, and 2, the amount of funds received by such state or territory pursuant to a payment made under this section or a transfer made under section 603C4. F, regulations. The Secretary shall have the authority to issue such regulations as may be necessary or appropriate to carry out this section. G, definitions. In this section, 1, covered period. The term covered period means, with respect to a state, territory, or tribal government, that the period that A begins on March 3rd, 2021, and B ends on the last day of the fiscal year of such state, territory, or tribal government, in which all funds received by the state, territory, or tribal government from a payment made under this section or a transfer made under section 603C4 have been expended or returned to or recovered by the Secretary. 2, Secretary. The term Secretary means the Secretary of the Treasury. 3, State. The term state means each of the 50 states and the District of Columbia. 4, Territory. The term territory means the Commonwealth of Puerto Rico, the United States Virgin Islands, Guam, the Commonwealth of the Northern Mariana Islands, and the American Samoa. 5, tribal government. The term tribal government means the recognized governing body of any Indian or Alaska Native tribe, band, nation, pueblo, village, community, component band, or component reservation individually identified, including parenthetically in the list published most recently of the date of the enactment of this act pursuant to Section 104 of the Federally Recognized Indian Tribe List Act of 1994, 25 U.S.C. 5131. Section 603, Coronavirus Local Fiscal Recovery Fund. A, appropriation. In addition to amounts otherwise available, there is appropriated for fiscal year 2021 out of any money in the Treasury not otherwise appropriated, $120,200 million to remain available through December 31st, 2024 for making payments under this section to metropolitan cities, non-entitlement units of local government, and counties to mitigate the fiscal effects stemming from the public health emergency with respect to the coronavirus COVID-19. B, authority to make payments. 1, metropolitan cities. A, in general, the amount appropriated under subsection A, the Secretary shall reserve $42 billion, $70 million to make payments to metropolitan cities. B, allocation and payment. From the amount reserved under subparagraph A, the Secretary shall allocate, in accordance with paragraph 7, pay to each metropolitan city an amount determined for the metropolitan city consistent with the formula under section 106B of the Housing and Community Development Act of 1974, 42 U.S.C. 5306B, except that, in applying such formula, the Secretary shall substitute all metropolitan cities for all metropolitan areas, each place it appears. 2, non-entitlement units of local government. A, in general, of the most appropriated under subsection A, the Secretary shall reserve $18,030 million to make payments to states for distribution by the state to non-entitlement units of local government in the state.
B, allocation and payment. From the amount reserved under subparagraph A, the Secretary shall allocate, and in accordance with paragraph 7, pay to each state an amount which bears the same proportion to such reserved amount as the total population of all non-entitlement units of local government in the state bears to the total population of all non-entitlement units of local government in all such states. C, distribution to non-entitlement units of local government. 1, in general, not later than 30 days after a state receives a payment under subparagraph B, the state shall distribute to each non-entitlement unit of local government in the state of an amount that bears the same proportion to the amount of such payment as the population of the non-entitlement unit of local government bears to the total population of all the non-entitlement units of local government in the state, subject to Clause 3. 2, distribution of funds. 1, extension for distribution. If an authorized officer of a state required to make distributions under Clause 1 certifies in writing to the Secretary before the end of the 30-day distribution period described in such clause that it would constitute an excessive administrative burden for the state to meet the terms of such clause with respect to one or more such distributions, the authorized officer may request, and the Secretary shall grant, an extension of such period of not more than 30 days to allow the state to make such distributions in accordance with Clause 1. 2, additional extensions. A, in general, if a state has been granted an extension to the distribution period under subclause 1 but is unable to make all distributions required under Clause 1 before the end of such period as extended, an authorized officer of the state may request an additional extension of the distribution period of not more than 30 days. The Secretary may grant a request for an additional extension of such a period only if AA, the authorized officer making such request, provides a written plan to the Secretary specifying for each distribution for which an additional extension is requested when the state expects to make such distribution, and the actions the state has taken and will take in order to make all such distributions before the end of the distribution period, as extended under subclause 1 and this subclause. And BB, the Secretary determines that such a plan is reasonably designed to distribute all such funds to non-entitlement units of local government by the end of the distribution period, also so extended. BB, further additional extensions. If a state granted an additional extension of the distribution period under item AA requires any further additional extensions of such period, the request only may be made and granted subject to the requirements specified in item AA. 3, capped amount. The total amount distributed to a non-entitlement unit of local government under this paragraph may not exceed the amount equal to 75% of the most recent budget for the non-entitlement unit of local government as of January 27, 2020. 4, return of excess amounts. Any amounts not distributed to a non-entitlement unit of local government as a result of the application of Clause 3 shall be returned to the Secretary. D, penalty for noncompliance. If by the end of the 120-day period that begins on the date a state receives a payment from the amount allocated under subparagraph B, or if later, the last day of the distribution period for the state, as extended with respect to the state under subparagraph C2, such state has failed to make all the distributions from such payment in accordance with the terms of subparagraph C, including any extensions of the distribution period granted in accordance with such subparagraph. An amount equal to the amount of such payment that remains undistributed as such state shall be booked as a debt of such state owed to the federal government, shall be paid back from the state's allocation provided under 602B3B3, and shall be deposited into the general fund of the Treasury. 3, counties. A, amount. From the amount appropriate under subsection A, the Secretary shall reserve and allocate $60,100,000,000 of such amount to make payments directly to counties in an amount which bears the same proportion to the total amount reserved under this paragraph as the population of each such county bears to the total population of all such entities, and shall pay such allocated amounts to such counties in accordance with paragraph 7. B, special rules. 1, urban counties. No county that is an urban county, as defined in Section 102 of the Housing and Community Development Act of 1974, 42 U.S.C. 5302, shall receive less than the amount the county would otherwise receive if the amount paid under this paragraph were allocated to metropolitan cities and urban counties under Section 106B of the Housing and Community Development Act of 1974, 42 U.S.C. 5306B. 2, counties that are not units of general local government. In the case of an amount to be paid to a county that is not a unit of a general local government, the amount shall instead be paid to the state in which such county is located, and such state shall distribute such amount to each unit of general local government within such county in an amount that bears the same proportion to the amount to be paid to such county, as the population of such units of general local government bears to the total population of such county. 3, District of Columbia. For purposes of this paragraph, the District of Columbia shall be considered to consist of a single county that is a unit of general local government. 4, consolidated governments. A unit of general local government that has formed a consolidated government or that is geographically contained in full or in part within the boundaries of another unit of general local government may receive a distribution under each of paragraphs 1, 2, and 3, as applicable based on the respective formulas specified in such paragraphs. 5, pro rata adjustment authority. The amounts otherwise determined for allocation and payment under paragraphs 1, 2, and 3 may be adjusted by the Secretary on a pro rata basis to the extent necessary to ensure that all available funds are distributed to metropolitan cities, counties, and states in accordance with the requirements specified in each paragraph as applicable, and the certification requirement specified in subsection D. 6, population. For purposes of determining allocations under this section, the population of an entity shall be determined based on the most recent data are available from the Bureau of the Census, or if not available, from such other data as a state determines appropriate. 7, timing. A, first tranche amount. To the extent practicable with respect to each metropolitan city for which an amount is allocated under paragraph 1, each state for which an amount is allocated under paragraph 2 for distribution to non-entitlement units of local government, and each county for which an amount is allocated under paragraph 3, the Secretary shall pay from such allocation the first tranche amount for such city, state, or county not later than 60 days after the date of enactment of this section. B, second tranche amount. The Secretary shall pay to each metropolitan city for which an amount is allocated under paragraph 1, each state for which an amount is allocated under paragraph 2 for distribution to non-entitlement units of local government, and each county for which an amount is allocated under paragraph 3, the second tranche amount for such city, state, or county not earlier than 12 months after the date on which the first tranche amount is paid to the city, state, or county. C, requirements. 1, use of funds. Subject to paragraph 2 and except as provided in paragraphs 3 and 4, a metropolitan city, non-entitlement unit of local government, or county shall only use the funds provided under a payment made under this section to cover costs incurred by the metropolitan city, non-entitlement unit of local government, or county by December 31st, 2024. A, to respond to the public health emergency with respect to the coronavirus disease 2019, COVID-19, or its negative economic impacts, including the assistance to households, small businesses, and nonprofits, or aid to impacted industries such as tourism, travel, and hospitality. B, for the provision of government services to the extent of the reduction in revenue of such metropolitan city, non-entitlement unit of local government, or county due to such emergency, or C, to make necessary investments in water, sewer, or broadband infrastructure. 2, pension funds. No metropolitan city, non-entitlement unit of local government, or county may use funds made available under this section for deposit into any pension fund. 3, transfer authority. A metropolitan city, non-entitlement unit of local government, or county receiving a payment from funds made available under this section may transfer funds to a private nonprofit organization, as that term is defined in paragraph 17 of section 401 of the McKinney-Vento Homeless Assistance Act, 42 U.S.C. 11360-17. A public benefit corporation involved in the transportation of passengers or cargo, or a special purpose unit of state or local government. 4, transfers to states. Notwithstanding paragraph 1, a metropolitan city, non-entitlement unit of local government, or county receiving a payment from funds made available under this section may transfer such funds to the state in which such entity is located. D, reporting. Any metropolitan city, non-entitlement unit of local government, or county receives funds provided under a payment made under this section shall provide to the Secretary periodic reports providing a detailed accounting of the use of such funds by such metropolitan city, non-entitlement unit of local government, or county, and including such other information as the Secretary may require for the administration of this section. E, recoupment. Any metropolitan city, non-entitlement unit of local government, or county that has failed to comply with subsection C shall be required to repay to the Secretary an amount equal to the amount of funds used in violation of such subsection. F, regulations. The Secretary shall have the authority to issue such regulations as may be necessary, appropriate to carry out this section. G, definitions in this section. 1, county. The term county means a county, parish, or other equivalent county division as defined by the Bureau of Census. 2, covered period. The term covered period means with respect to the metropolitan city, non-entitlement unit of local government, or county receiving funds under this section, that period that begins on March 3rd, 2021, and B, ends on the last day of the fiscal year of the metropolitan city, non-entitlement unit of local government, or county in which all of the funds received by the metropolitan city, non-entitlement unit of local government, or county under this section have been expended, or returned to, or recovered by the Secretary. 3, first tranche amount. The term first tranche amount means with respect to each metropolitan city for which an amount is allocated under subsection B1, each state for which an amount is allocated under subsection B2 for distribution to non-entitlement units of local government, and each county for which an amount is allocated under subsection B3, 50% of the amount so allocated to such metropolitan city, state, or county as applicable. 4, metropolitan city. The term metropolitan city is the meaning given the term in section 102A4 of the Housing and Community Development Act of 1974, 42 U.S.C. 5302A4, and includes cities that relinquish or defer their status as a metropolitan city for purposes of receiving allocations under section 106 of such act, 42 U.S.C. 5306 for fiscal year 2021. 5, non-entitlement unit of local government. The term non-entitlement unit of local government means a city, as that term is defined in section 102A5 of the Housing and Community Development Act of 1974, 42 U.S.C. 5302A5, that is not a metropolitan city. 6, second tranche amount. The term second tranche amount means with respect to each metropolitan city for which an amount is allocated under subsection B1, each state for which an amount is allocated under subsection B2 for distribution to non-entitlement units of local government, and each county for which an amount is allocated under subsection B3, an amount not to exceed 50% of the amount so allocated to such metropolitan city, state, or county as applicable. 7, secretary. The term secretary means the Secretary of the Treasury. 8, state. The term state means each of the 50 states, the District of Columbia, the Commonwealth of Puerto Rico, the United States Virgin Islands, Guam, and the Commonwealth of the Northern Mariana Islands, and American Samoa. 9, unit of general local government. The term unit of general local government has the meaning given that term in Section 102A1 of the Housing and Community Development Act of 1974, 42 U.S.C. 5302A1, Section 604, Coronavirus Capital Projects Fund. A, appropriation. In addition to amounts otherwise available, there's appropriated for fiscal year 2021 out of any money in the Treasury not otherwise appropriated, $10 billion to remain available until expended for making payments to states, territories, and tribal governments to carry out critical capital projects, directly enabling work, education, and health monitoring, including remote options in response to the public health emergency with respect to coronavirus disease, COVID-19. B, payments to each of the 50 states and the District of Columbia. 1, minimum amounts. From the amount appropriated under subsection A. A, the Secretary shall pay $100 million to each state. B, the Secretary shall pay $100 million to the Commonwealth of Puerto Rico and $100 million to the District of Columbia. C, the Secretary shall pay $100 million of such amount in equal shares to the United States Virgin Islands, Guam, American Samoa, the Commonwealth of the Northern Mariana Islands, the Republic of the Marshall Islands, the Federated States of Micronesia, and the Republic of Palau. And D, the Secretary shall pay $100 million of such amount to tribal governments and the state of Hawaii, in addition to the amount paid to the state of Hawaii under subparagraph A, of which 1, not less than $50,000 shall be paid to each tribal government, and 2, not less than $50,000 shall be paid to the state of Hawaii for the exclusive use of the Department of Hawaiian Homelands and the Native Hawaiian education programs to assist Native Hawaiians in accordance with this section. 2, remaining amounts. A, in general, from the amount of the appropriation under subsection A that remains after the application of paragraph 1, the Secretary shall make payments to the states based on population such that 1, 50% of such amount shall be allocated among the states based on the proportion that the population of each state bears to the population of all states. 2, 25% of such amount shall be allocated among the states based on the proportion that the number of individuals living in rural areas in each state bears to the number of individuals living in rural areas in all states. And 3, 25% of such amount shall be allocated among the states based on the proportion that the number of individuals within a household income that is below 150% of the poverty line applicable to a family of the size involved in each state bears to the number of such individuals in all states. B, data. In determining the allocations to be made to each state under subparagraph A, the Secretary of the Treasury shall use the most recent data available from the Bureau of the Census. C, timing. The Secretary shall establish a process of applying for grants to access funding made available under Section B not later than 60 days after enactment of this section. D, definitions. In this section, 1, Secretary. The term Secretary means the Secretary of the Treasury. 2, State. The term state means one of the 50 states. 3, tribal government. The term tribal government has the meaning given such term in section 603G. B, conforming amendment. The heading for Title VI of the Social Security Act, 42 U.S.C. 801 at sequential, is amended by striking fund and inserting Fiscal Recovery and Critical Capital Projects Fund. Subtitle N, Other Provisions. Section 9911, Funding for Providers Relating to COVID-19. Part A of Title 11 of the Social Security Act, 42 U.S.C. 1301 in sequential, and is amended by adding to the end of the following. Section 1150C, funding for providers relating to COVID-19. A, funding. In addition to amounts otherwise available, there is appropriated to the Secretary for fiscal year 2021. Out of any monies in the Treasury not otherwise appropriated, $8,500,000,000 for purposes of making payments to eligible health care providers for health care related expenses and lost revenues that are attributable to COVID-19. Amounts appropriated under the preceding sentence shall remain available until expended. B, special rule regarding parent organizations. In the case of any payment made under this section to an eligible health care provider, but which is received by a parent organization of such provider, such parent organization shall allocate all of such payment to such provider. C, application requirement. To be eligible for a payment under this section, an eligible health care provider shall submit to the Secretary an application in such form and manner as the Secretary shall prescribe. Such application shall contain the following. 1, a statement justifying the need of the provider for the payment, including documentation of the health care related expenses attributable to COVID-19 and the lost revenues attributable to COVID-19. 2, the tax identification number of the provider. 3, such assurances as the Secretary determines appropriate that the eligible health care provider will maintain and make available such documentation and submit such reports at such time in such form and containing such information as the Secretary shall prescribe, as the Secretary determines is necessary to ensure compliance with any conditions imposed by the Secretary under this section. 4, any other information determined appropriate by the Secretary. D, limitation. Payments made to an eligible health care provider under this section may not be used to reimburse any expense or loss that 1, has been reimbursed from another source, or 2, another source is obligated to reimburse. E, application of requirements, rules, and procedures. The Secretary shall apply any requirements, rules, or procedures as the Secretary deems appropriate for the efficient execution of this section. F, definitions. In this section, 1, eligible health care provider. The term eligible health care provider means A, a provider of services as defined in Section 1861U, or a supplier as defined in Section 1861D that 1, is enrolled in the Medicare program under Title 18 under Section 1866J, including temporarily enrolled during the emergency period described in Section 1135G1B for such period. 2, provides diagnoses, testing, or care for individuals with possible or actual cases of COVID-19. And 3, is located in a rural area or treated as located in a rural area pursuant to Section 1886D8E. Or B, a provider or supplier that 1, is enrolled with a state Medicaid plan under Title 19 or a waiver of such plan in accordance with subsections A, 77, and KK of Section 1902, including enrolled pursuant to Section 1902A78 or Section 1932D6, or enrolled with a state child health plan under Title 21 or a waiver of such plan in accordance with subparagraph G of Section 2107E1, including enrolled pursuant to subparagraph D or Q of such section. 2, provides diagnoses, testing, or care for individuals with possible or actual cases of COVID-19. And 3, is located in a rural area.
Two, healthcare-related expenses attributable to COVID-19. The term healthcare-related expenses attributable to COVID-19 means healthcare-related expenses to prevent, prepare for, and respond to COVID-19, including the building or construction of a temporary structure, the leasing of a property, the purchase of medical supplies and equipment, including personal protective equipment and testing supplies, providing for increased workforce training and including maintaining staff, obtaining additional staff for both, the operation of an emergency operations center, retrofitting a facility, providing for surge capacity and other expenses determined appropriate by the Secretary. 3, lost revenue attributable to COVID-19. The term lost revenue attributable to COVID-19 as the meaning given that term in the frequently asked questions guidance released by the Department of Health and Human Services in June 2020, including the difference between such providers' budgeted and actual revenue if such budget had been established and approved prior to March 27, 2020. 4, payment. The term payment includes, as determined appropriate by the Secretary, a prepayment, a prospective payment, a retrospective payment, or a payment through a grant or other mechanism. 5, rural area. The term rural area means A, a rural area as defined in Section 1886, D2D, or B, any other rural area as defined by the Secretary. Section 9912, extension of customs user fees. A, in general, Section 13031J3 of the Consolidated Omnibus Budget Reconciliation Act of 1985, 19 U.S.C. 58CJ3 is amended. 1, in subparagraph A by striking October 21st, 2029, and inserting September 30th, 2030. And 2, in subparagraph B1 by striking October 21st, 2029, and inserting September 30th, 2030. B, rate for merchandise processing fees. Section 503 of the United States-Korea Free Trade Agreement Implementation Act, Public Law 112-41, 19 U.S.C. 3805, note, is amended by striking October 21, 2029, and inserting September 30th, 2030. Title 10, Committee on Foreign Relations. Section 10,001, Department of State Operations. In addition to amounts otherwise available, there is authorized and appropriated to the Secretary of State for fiscal year 2021, out of any money in the Treasury not otherwise appropriated, $204 million to remain available until September 30th, 2022, for necessary expenses of the Department of State to carry out the authorities, functions, duties, and responsibilities in the conduct of foreign affairs of the United States to prevent, prepare for, and respond to coronavirus domestically or internationally, which shall include maintaining Department of State operations. Section 10,002, United States Agency for International Development Operations. In addition to amounts otherwise available, there is authorized and appropriated to the Administrator of the United States Agency for International Development for fiscal year 2021, out of any money in the Treasury not otherwise appropriated, $41 million to remain available until September 30th, 2022, to carry out the provisions of Section 667 of the Foreign Assistance Act of 1961, 22 U.S.C. 2427, for necessary expenses of the United States Agency for International Development to prevent, prepare for, and respond to coronavirus domestically or internationally, and for other operations and maintenance requirements related to coronavirus. Section 10,003, Global Response. A, in general, in addition to amounts otherwise available, there is authorized and appropriated to the Secretary of State for fiscal year 2021, out of any money in the Treasury not otherwise appropriated, $8,675 million to remain available until September 30th, 2022, for necessary expenses to carry out the provisions of Section 531 of Chapter 4 of Part 2 of the Foreign Assistance Act of 1961, 22 U.S.C. 2346, as health programs to prevent, prepare for, and respond to coronavirus, which shall include recovery from the impacts of such virus and shall be allocated as follows. 1, $905 million to be made available to the United States Agency for International Development for global health activities to prevent, prepare for, and respond to coronavirus, which shall include a contribution to a multilateral vaccine development partnership to support epidemic preparedness. 2, $3,750 million to be made available to the Department of State to support programs for the prevention, treatment, and control of HIV/AIDS in order to prevent, prepare for, and respond to coronavirus, including to mitigate the impact on such programs from coronavirus and support recovery from the impacts of the coronavirus, of which not less than $3,500 million shall be for a United States contribution to the Global Fund to fight AIDS, tuberculosis, and malaria. 3, $3,090 million to be made available to the United States Agency for International Development to prevent, prepare for, and respond to coronavirus, which shall include support for international disaster relief, rehabilitation, and reconstruction, for health activities and to meet emergency food security needs, and 4, $930 million to be made available to prevent, prepare for, and respond to coronavirus, which shall include activities to address economic and stabilization requirements resulting from such virus. B, waiver of limitations. Any contribution to the Global Fund to fight AIDS, tuberculosis, and malaria made pursuant to subsection A2 shall be made available notwithstanding Section 202D4A1 of the United States Leadership Against HIV/AIDS, Tuberculosis, and Malaria Act of 2003, 22 U.S.C. 7622D4A1. And such contribution shall not be considered a contribution for the purpose of applying such Section 202D4A1. Section 10,004, Humanitarian Response. A, in general, in addition to amounts otherwise available, there is authorized and appropriated to the Secretary of State for fiscal year 2021 out of any money in the Treasury not otherwise appropriated, $500 million to remain available until September 30th, 2022 to carry out the provisions of Section 2A and B of the Migration and Refugee Assistance Act of 1962, 22 U.S.C. 2601A and B, to prevent, prepare for, and respond to coronavirus. B, use of funds. Funds appropriated pursuant to this section shall not be made available for the costs of resettling refugees in the United States. Section 10,005, Multilateral Assistance. In addition to amounts otherwise available, there is authorized and appropriated to the Secretary of State for fiscal year 2021 out of any money in the Treasury not otherwise appropriated, $580 million to remain available until September 30th, 2022, to carry out the provisions of Section 301A of the Foreign Assistance Act of 1961, 22 U.S.C. 2221A, to prevent, prepare for, and respond to coronavirus, which shall include support for the priorities and objectives of the United Nations Global Humanitarian Response Plan, COVID-19, through voluntary contributions to international organizations and programs administered by such organizations. Title 11, Committee on Indian Affairs. Section 11,001, Indian Health Services. A, in addition to amounts otherwise available, there is appropriated to the Secretary of Health and Human Services in this section referred to as the Secretary for fiscal year 2021 out of any money in the Treasury not otherwise appropriated, $6.094 billion to remain available until expended, of which one, $5.484 billion shall be for carrying out the Act of August 5th, 1954, 42 U.S.C. 2001, commonly referred to as the Transfer Act, the Indian Self-Determination and Education Assistance Act, 25 U.S.C. 5301, the Indian Health Care Improvement Act, 25 U.S.C. 1601, and Titles 2 and 3 of the Public Health Service Act, 42 U.S.C. 201 and 241 with respect to the Indian Health Service, of which A, $2 billion shall be for lost reimbursements in accordance with Section 207 of the Indian Health Care Improvement Act, 25 U.S.C. 1621F. B, $500 million shall be for the provision of additional health care services, services provided through the Purchase Referred Care Program and other related activities. C, $140 million shall be for information, technology, telehealth, infrastructure, and the Indian Health Service Electronic Health Records System. D, $84 million shall be for maintaining operations of the Urban Indian Health Program, which shall be in addition to other amounts made available under this subsection for urban Indian organizations. As defined in Section 4 of the Indian Health Care Improvement Act, 25 U.S.C. 1603. E, $600 million shall be for necessary expenses to plan, prepare for, promote, distribute, administer, and track COVID-19 vaccines for the purposes described in subparagraphs F and G and for other vaccine-related activities. F, $1.5 billion shall be for necessary expenses to detect, diagnose, trace, and monitor COVID-19 infections, activities necessary to mitigate the spread of COVID-19, supplies necessary for such activities for the purposes described in subparagraphs E and G, and for other related activities. G, $240 million shall be for necessary expenses to establish, expand, and sustain a public health workforce to prevent, prepare for, and respond to COVID-19, other public health workforce-related activities for the purposes described in subparagraphs E and F, and for other related activities. And H, $420 million shall be for necessary expenses related to mental health and substance use prevention and treatment services for the purposes described in subparagraph C and paragraph 2 as related to mental health and substance use prevention and treatment services and for other related activities. 2, $600 million shall be for the lease, purchase, construction, alteration, renovation, or equipping of health facilities to respond to COVID-19 and for maintenance and improvement projects necessary to respond to COVID-19 under Section 7 of the Act of August 5th, 1954. 42 U.S.C. 2004A. The Indian Self-Determination and Education Assistance Act, 25 U.S.C. 5301, the Indian Healthcare Improvement Act, 25 U.S.C. 1601, and Titles 2 and 3 of Public Health Service Act, 42 U.S.C. 202 with respect to the Indian Health Service. And 3, $10 million shall be for carrying out Section 7 of the Act of August 5th, 1954, 42 U.S.C. 2004A for expenses relating to potable water delivery. B, funds appropriated by subsection A shall be made available to restore amounts either directly or through reimbursement for obligations for the purposes specified in this section that were incurred to prevent, prepare for, and respond to COVID-19 during the period beginning on the date on which the public health emergency was declared by the Secretary on January 31st, 2020, pursuant to Section 319 of the Public Health Service Act, 42 U.S.C. 247D, with respect to COVID-19 and ending on the date of the enactment of this act. C, funds made available under subsection A to tribes and tribal organizations under the Indian Self-Determination and Education Assistance Act, 25 U.S.C. 5301, shall be available on a one-time basis. Such non-recurring funds shall not be part of the amount required by Section 106 of the Indian Self-Determination and Education Assistance Act, 25 U.S.C. 5325, and such funds shall only be used for the purposes identified in this section. Section 11,002, Bureau of Indian Affairs. A, in general, in addition to amounts otherwise made available, there is appropriated for fiscal year 2021, out of any money in the Treasury not otherwise appropriated, $900 million to remain available until expended, pursuant to the Snyder Act, 25 U.S.C. 13, of which $100 million shall be for tribal housing improvements. 2, $772,500,000 shall be for tribal government services, public safety and justice, social services, child welfare assistance, and for other related expenses. 3, $7,500,000 shall be for related federal administrative costs and oversight. And 4, $20 million shall be to provide and deliver potable water. B, exclusions from calculation. Funds appropriated under subsection A shall be excluded from the calculation of funds received by those tribal governments that participate in the small and needy program. C, one-time basis funds. Funds made available under subsection A to tribes and tribal organizations under the Indian Self-Determination and Education Assistance Act, 25 U.S.C. 5301, shall be available on a one-time basis. Such non-recurring funds shall not be part of the amount required by Section 106 of the Indian Self-Determination and Education Assistance Act, 25 U.S.C. 5325, and such funds shall only be used for the purposes identified in this section. Section 11,003, Housing Assistance and Supportive Services Programs for Native Americans. A, appropriation. In addition to amounts otherwise available, there is appropriated to the Secretary of Housing and Urban Development, in this section referred to as the Secretary for fiscal year 2021, out of any money in the Treasury not otherwise appropriated, $750 million to remain available until September 30th, 2025, to prevent, prepare for, and respond to coronavirus for activities and assistance authorized under Title I of the Native American Housing Assistance and Self-Determination Act of 1996, 25 U.S.C. 4111 under Title VIII of NAHASDA 25 U.S.C. 4221, and under Section 106A1 of the Housing Community Development Act of 1974 with respect to Indian tribes, 42 U.S.C. 5306A1, which shall be made available as follows. 1. Housing block grants. $455 million shall be available for the Native American Housing Block Grants and Native Hawaiian Housing Block Grant Programs as authorized under Titles I and VIII of the NAHASDA, subject to the following terms and conditions. A, formula. Of the amounts made available under this paragraph, $450 million shall be for grants under Title I of NAHASDA and shall be distributed according to the same funding formula used in fiscal year 2021. B, Native Hawaiians. Of the amounts made available under this paragraph, $5 million shall be for grants under Title VIII of NAHASDA. C, use. Amounts made available under this paragraph shall be used by recipients to prevent, prepare for, and respond to coronavirus, including to maintain normal operations and fund eligible affordable housing activities under NAHASDA during the period that the program is impacted by coronavirus. In addition, amounts made available under subparagraph B may be used to provide rental assistance to eligible Native Hawaiian families, both on and off the Hawaiian homelands. D, timing of obligations. Amounts made available under this paragraph shall be used as necessary to cover or reimburse allowable costs to prevent, prepare for, and respond to coronavirus that are incurred by a recipient, including for costs incurred after January 21st, 2020. E, waivers or alternative requirements. The Secretary may waive or specify alternative requirements for any provision of NAHASDA 25 U.S.C. 4101 or regulation applicable to Native American housing. Block grants or Native Hawaiian Housing Block Grant Program, other than requirements related to fair housing, non-discrimination, labor standards, and the environment, upon a finding that the waiver or alternative requirement is necessary to expedite or facilitate the use of amounts made available under this paragraph. F, unobligated amounts. Amounts made available under this paragraph which are not accepted are voluntarily returned or otherwise recaptured for any reason shall be used to fund grants under paragraph 2. 2, Indian Community Development Block Grants. $280 million shall be available for grants under Title I of the Housing and Community Development Act of 1974, subject to the following terms and conditions. A, use. Amounts made available under this paragraph shall be used without competition for emergencies that constitute imminent threats to health and safety and are designed to prevent, prepare for, and respond to coronavirus. B, planning, not to exceed 20% of any grant made with funds made available. Under this paragraph shall be expended for planning and management, development, and administration. C, timing of obligations. Amounts made available under this paragraph shall be used as necessary to cover or reimburse allowable costs to prevent, prepare for, and respond to coronavirus incurred by a recipient, including for costs incurred after January 21st, 2020. D, inapplicability of public services cap. Indian tribes may use up to 100% of any grant from amounts made available under this paragraph for public services activities to prevent, prepare for, and respond to coronavirus. E, waivers of alternative requirements. The Secretary may waive or specify alternative requirements for any provision of Title I of the Housing Community Development Act of 1974, 42 U.S.C. 5301, or regulation applicable to the Indian Community Development Block Grant Program, other than requirements related to fair housing, non-discrimination, labor standards, and the environment upon a finding that the waiver or alternative requirement is necessary to expedite or facilitate the use of the amounts made available under this paragraph. 3, technical assistance. $10 million shall be used to make new awards, to increase prior awards to existing technical assistance providers, to provide an immediate increase in training and technical assistance to Indian tribes, Indian housing authorities, tribally designated housing entities, and recipients under Title VIII of the NAHSDA for activities under this section. 4, other costs. $5 million shall be used for administrative costs to oversee and administer the implementation of this section and pay for associate information technologies, financial reporting, and other costs. Section 11,004, COVID-19 response resources for the preservation and maintenance of Native American languages. A, Section 816 of the Native American Programs Act of 1974, 42 U.S.C. 2992D is amended by adding at the end the following. F, in addition to the amounts otherwise available, there is appropriated for fiscal year 2021 out of any money in the Treasury not otherwise appropriated, $20 million to remain available until expended to carry out Section 803 CG of this Act. B, Section 803C of the Native American Programs Act of 1974, 42 U.S.C. 2991B3 is amended by adding at the end the following. G, emergency grants for Native American language preservation and maintenance. Not later than 180 days after the effective date of this subsection, the Secretary shall award grants to entities eligible to receive assistance under subsection A1 to ensure the survival and continuing vitality of Native American languages during and after the public health emergency declared by the Secretary pursuant to Section 319 of the Public Health Service Act, 42 U.S.C. 247D with respect to the COVID-19 pandemic. Section 11,005, Bureau of Indian Education. In addition to amounts otherwise available, there is appropriated to the Bureau of Indian Education for fiscal year 2021, out of any money in the Treasury not otherwise appropriated, $850 million to remain available until expended, to be allocated by the Director of the Bureau of Indian Education not more than 45 calendar days after the date of the enactment of this act for programs or activities operated or funded by the Bureau of Indian Education. For Bureau-funded schools, as defined in Section 1141.3 of the Education Amendments of 1978, 25 U.S.C. 2021-3, and for tribal colleges and universities, as defined in Section 316b3 of the Higher Education Act of 1965, 20 U.S.C. 1059 CB3. Section 11,006, American Indian, Native Hawaiian, and Alaska Native Education. In addition to amounts otherwise available, there is appropriated to the Department of Education for fiscal year 2021, out of any money in the Treasury not otherwise appropriated, $190 million to remain available until expended for awards, which shall be determined by the Secretary of Education not more than 180 calendar days after the date of the enactment of this act, of which, 1, $20 million shall be for awards for tribal education agencies for activities authorized under Section 6121C of the Elementary and Secondary Education Act of 1965, 20 U.S.C. 7441C. 2, $85 million shall be awards to entities eligible to receive grants under Section 6205A1 of the Elementary and Secondary Education Act of 1965, 20 U.S.C. 7515A1 for activities authorized under Section 6205A3 of the Elementary and Secondary Education Act of 1965, 20 U.S.C. 7515A3, and 3, $85 million shall be for awards to entities eligible to receive grants under Section 6304A1 of the Elementary and Secondary Education Act of 1965, 20 U.S.C. 7544A1 for activities authorized under Section 6304A23 of the Elementary and Secondary Education Act of 1965, 20 U.S.C. 7544A23, and other related activities.
Madam President.
The junior senator from Maryland.
Madam President, I ask unanimous consent that when the Senate completes its business today, it adjourn until 9 a.m. Friday, March 5th, that following the prayer and pledge, the morning hour be deemed expired, the Journal of Proceedings be approved to date, the time for the two leaders be reserved for their use later in the day, and morning business be closed. Finally, that following morning business, the Senate resume consideration of H.R. 1319, and there be 3 hours of debate remaining, with the time equally divided and controlled between the two managers or their designees, and that it be in order for Senator Sanders to offer the First Amendment.
Is there objection? Without objection.
If there is no further business to come before the Senate, I ask that it stand adjourned under the previous order.
The Senate has adjourned until 9 a.m. this morning.
Give it to me. Give it to me. Yeah.
Annoying, but we think it's a shame. All fine time to chat and go live and get with the House and Senate on the phone and online. We even tweet the press when we feel like we're stuck on Bill S4227. We just say we're out of luck, but I think that it's time that they hear our voice and then we say it louder because it's our choice. We say, hey, we want our 10K. Got it? We got it! Over 50,000 phone calls, even more emails. Speaking seats, subscribers shows us how to prevail. Come on! They never stopped or doubted, even went to DC. Said speak, go to the White House and the Capitol, please. We got kicked off the doorstep of the senator, but it only fueled the fire, made us fight even more. Now 8 months later, closing in on holiday, we can say with confidence we got our 10K. We singing, hey, we got our 10K. Come on. Hey, we got our 10K. Hey, we got our 10K. Hey, we got our 10K.
Yeah.
They promised us a grant. Now there doesn't seem to be anyone around. They promised us 10K, but now the money is nowhere to be found.
Roughly $80 billion in CARES Act.
We're gonna get our 10K. Idle, idle. We're gonna get our 10K. Idle, yeah, I think so. We're gonna get our idol. We're calling, we're blogging, we're sizing them up. Cause they promised tall, delivered small, and now we want our money. Hanging with Speak and See, and we're looking for some action. Cause with the SBA we can't get no satisfaction. The grant was for 10K, and it was signed and it was stated on CARES Act S4227. Now Congress is constipated. They constipated. Dig if you will, CARES Act. Promise you something you don't get. Then they want you to forget about it. This is what it sounds like. Ridiculous. Push it. Push it good. Push it. We want a 10K. They promised us a grant. Now there doesn't seem. Word. Heard. Word. Hey Congress, what you gonna do? Yep. What you gonna do to get the bill passed through? Right. Hey Congress, what you gonna do? What you gonna do to get the bill passed through? Right. You told us go inside, shut our doors and run and hide, and we listened to you say that the funds you would provide. We ain't asking for a handout, but you need to keep